Good afternoon. It's good to be with you this morning. I live in Richfield, Utah. Does anyone know where Richfield is? Okay, 3.
70.
Okay, out to 70. Some people stop there for gas. So I'm about 2.5 hours south of here. So it actually feels good to stand because I've been driving a good chunk in the morning. So, all right. So as I mentioned, I'm going to talk a little about leadership principles. I'm not even a mid-careerist, so I'm still learning, to be totally honest with you. There's a lot I am still learning, but I'll share with you some things that I've learned personally, and then some things that I've learned from some great mentors that have helped mentor me. Let's see if I can get it to work. All right, so my journey into leadership. My early track record, I thought I was 0 for 2 running for student body officer in high school. My mom said it was actually 0 for 3, which just goes to show you that moms actually take it a little harder than their kids do. So my point here in saying this is that, you know, I think there's this sometimes impression that, you know, leaders are identified really early and born early, and that you identify those traits really quickly. But I think in reality, and I'll talk a little about some leaders that I've seen, that's not always the case. I think the reality is sometimes you develop those leadership attributes or interests or desires later on, and those opportunities come later on, you're able to hone some of those skills. So my point here is I didn't necessarily have all this leadership experience in high school, student body officer, different things. It was not meant to be at that time, and that was okay. But I was able to do some other things in leadership later on that helped prepare me. Here, see if we can figure it out.
Is it left or right arrows?
There we go. So in high school, I decided I was going to be a dentist because Utah doesn't have enough dentists, right? So that's my grandfather right here. Richard Ellis, he was a dentist. My uncle actually became a dentist, so I was just going to go into the family business, right? That was the plan. Pretty early on in high school, I started shadowing my uncle, kind of thinking that was the path I was going to do, and that's the plan that I wanted to head down. So I get into college, as mentioned, I probably go to the University of Utah. I have a 2-year gap because I serve a mission for my church, and I get into general chemistry, and I did not do really well. I hated it. It was not a great fit. And then I got into organic chemistry, and things weren't getting any better. I was competing against these AP students. I hadn't touched chemistry in 3 years, and I was really kind of struggling, and I was frustrated because 4, 5, 6 years the plan had been I was doing dentistry, going to be a dentist. That was the plan. I didn't really have kind of a plan B, plan C, and so it kind of threw me for a loop. So I started volunteering as a Spanish interpreter at University of Utah hospitals and clinics, and I did this frankly just to keep my Spanish up. I'd taken 2 years to learn it. I knew you could lose it pretty quick, and so I wanted to keep my Spanish going. There wasn't really any more of an intent than that. And I fell in love with the hospital environment. I really did. We were interpreting in the ER and the hospital space. I ended up turning into a job later down the road, which was really awesome because I'd be on campus and they'd call me and say, "Can you come interpret?" And I'd say yes or no and zip over there. It was an awesome job. But I really enjoyed the hospital setting, and I didn't think I would. I decided there's no neutral on hospitals. You either hate going into them because of some core memory or something that's happened, or you really like them. And I fell into the category of really liking the hospital setting. I also like the idea of being a part of something that was mission driven. And by that, I mean an organization, you know, when people come to the hospitals, other than having a baby, it's not really a planned, pleasant, sort of exciting experience, right? It's usually you're going to get something fixed, you're in a trauma situation, there's a lot of different things that could be going on. And so, you know, you're with people in some of their most vulnerable times. And it's an opportunity to help people, given your skill set during those vulnerable times. And then I finally cracked my way into some leadership positions. Like I said, I think it was a little bit of a late bloomer leadership-wise. And I got involved in some leadership positions in the fraternity I was involved in there. And then I actually got involved with the Student Alumni Board. And I became president of the University of Utah Student Alumni Board. And I got to have some leadership experience in college, which I think was helpful for me to kind of test the waters of, is this something I like? Is this something I want to do? So one of the things that I would really recommend that you do as you're kind of thinking about careers is shadow someone in that career. Spend it, you know, if you're going to spend time in college and in classes towards a degree, towards a career, it's worth 8, 10 hours, whatever that shadowing time may be, to actually shadow someone and say, is this something I can see myself doing long term? And so that's what I did. My dad was in hospital administration, but got out after about 10 years and does organ and tissue donation for the state. But he still had a lot of contacts. And one of those contacts was this guy, Jim Sheets. Jim at that point was the assistant administrator at LDS Hospital in downtown Salt Lake. And I just kind of cold called Jim. I think I may have texted him or something at that point and said, hey, I'm looking at hospital administration. Can I come spend a day with you? And Jim was great. I think I try to be the same way. I've had opportunities because of Jim, and I try to give others opportunities because there really is a pay it forward mentality. But I spent a day with Jim in his role as assistant administrator of the hospital there. And like I said, it kind of just confirmed what I liked. A lot of meetings for sure. But it was fast paced, it was quick. He was rounding a lot with different staff, with patients, and I liked it. It was something I really enjoyed. The interesting part on this is 15 years later, Jim Sheets became my boss. And so he actually just moved into a new role, and so I've got a new boss within the last month. But part of my purpose in saying that is leadership is a small world. The chances are, regardless of your industry, you're probably going to cross paths with people decades down the road. And so forming some of that networking and that relationships is really critical. I think it's really critical in healthcare administration, which is what I went into. But I think in any career, importantly, and certainly leadership, it's definitely critical in that as well. So I started applying to graduate schools. The graduate school was a master's in healthcare administration. I think of it like a specialized MBA. It's 2 years, but it's focused specifically on healthcare. Applied to several grad schools. I kind of wanted, ones that were performing really well, or I felt like were a good fit. And I was accepted to the University of Minnesota, their Masters of Healthcare Administration. I went out to Minnesota. I learned what winters are really like. It's extremely cold out there, but it was an incredible experience. Lots of different hospitals, several different health systems. I got the opportunity to complete an administrative fellowship or internship, at Maple Grove Hospital. So how these MHA programs work is most programs have you do an internship between your first and second year of graduate school. And so Maple Grove is unique. They actually have a moratorium on hospitals in Minnesota. So the state basically decides when you get to build a hospital. It's not determined by the market. And Maple Grove was one of the first hospitals built in like 10 years. So it's a really unique experience to be a part of a brand new hospital. I got to work under the chief nursing officer there. And then after my second year, I completed administrative fellowship at St. Luke's Health System in Boise, Idaho. And I worked under the CEO of the Boise Hospital there. And part of why I'm telling you this is these internship and fellowship opportunities are pretty unique. They're not the highest paid. I had several classmates come out of grad school and say, I'm not doing a fellowship, I'm going straight to work. And probably got paid, more off the gate. But I think these experiences under senior leaders are invaluable. And I wouldn't have given that up. And so, if you ever get the opportunity to do any type of internship, even if it's free, right, for a certain point, if you can afford to do that, I really would recommend you try that. Because if you're able to work on your senior leadership, it's a pretty incredible experience. You get to learn pretty quickly and very much firsthand under senior leaders, really quick leadership skills. So like I said, I went to St. Luke's Health System. I did a 1-year fellowship. So most fellowships are 1 to 2 years. It kind of depends on the program that you're in. And then after that, it's not guaranteed. There's no promises made, right? But hopefully, if it's a good fit for you, if it's a good fit for the organization, you land a role after. And so I was able to land a manager of operations role. And I had primary responsibility over environmental services. That's a real technical name for what's more commonly referred to as housekeeping services in the hospital. And I was at 2 of our largest hospitals in our health system. So Meridian, if you've ever been up to Idaho, was Meridian and Boise. So one's about a 300-bed hospital, the other one's about a 150-bed hospital. So fairly large hospitals. We had about 150 FTEs, it's full-time equivalents, so staff. And then it was a really diverse workforce. There's a huge Bosnian refugee population there in Boise, which I didn't realize till I moved there. And I learned a lot about cultures. I learned a lot about some of the challenges between the different religious groups there, and that kind of played out in the workforce. And the previous manager retired. That's how the position opened up. And he kind of checked out probably 2 or 3 years before I got there. So it was a little bit of experience, I would say, in change management. I'll never forget, it's like day 3, I get a call from HR, Human Resources, to say we need to talk to you. And one of the evening supervisors had filled out, we have caregiver surveys. It's a survey basically caregivers, employees fill out every year. And they say, you know, how's their work life? How's their job going? How do they feel about their supervisor? The supervisor had gone and actually filled the survey out for all the employees, which obviously wasn't allowed. Big no-no. And so the HR manager basically said, we're going to have to terminate this employee. So there I am, day 3, manager of operations, brand new in my role. I have to bring her in, have HR get involved, and we have to terminate that employee. And I went home thinking, I can't do this. I don't want to be firing people. This is not something I really want to do. I understood it was part of the job. And we just had a lot of experience kind of, and cleaning house is probably the wrong word, but we had some bad apples that were really driving down the culture of the department. And we had to really do some significant things to turn things around. I was able to hire a nurse to manage EVS, which is pretty unheard of, that was an expert in infection prevention. And so that was great because she brought some fantastic expertise with her in really helping us become, better prepared. I remember a doc saying to me, geez, you went to all this school and all this to just manage housekeeping. I told my boss that because I was kind of a little deflated. And she said, if you can manage housekeeping, environmental services, you can manage any department, including physicians. And turned out she was right. I've been able to take a lot of lessons I learned managing, although it was tough, managing that department that really allowed me to understand change management and what it really takes to do that. So an opportunity came up with year and a half to take on a director of operations role. So this was expanded. In addition to EBS, I was going to take on food and nutrition services. I was going to take on something called clinical engineering, which if you've seen all the different monitors and devices they have in hospitals, that's what clinical engineering does. They're responsible for the maintenance, making sure all those machines work, that they've been checked, and they're safe for patients. And then I had central laundry. So St. Luke's had a central laundry service that served all 6 or 7 hospitals throughout the system there in Idaho. So it was an expanded portfolio. It was an exciting opportunity. I jumped up to 400 FTEs that I was overseeing there. And so it was a really great experience. Things were going really well. And my wife and I wanted to get back to Utah, but it was like this 5 to 10 year plan, right? We bought a house in Meridian. The plan was I just start networking. So as I said at the beginning, that's, at least in my profession, networking is pretty critical. And so I just started meeting with different hospital administrators, with Intermountain, with the U, with HCA, Mountain Star, just kind of feeling it out, seeing opportunities, introducing myself. And so, an opportunity came along, and down in Richfield, position opened up with the Director of Ancillary and Support Services, sort of an assistant administrator role. Paul asked me at the beginning what that was. So I oversaw imaging, lab, EBS, laundry, food services, respiratory, sleep, maintenance, security, nursing, emergency management, compliance. I put et cetera because in small hospitals, you get to wear lots and lots of hats, which is actually kind of fun. I actually kind of enjoy it. You kind of become a jack of all trades. It's unique because you get your hands in a lot of different places versus a big hospital. There's a department dedicated to that. You just hand it over to them. But this was an interesting move because I actually took a little bit of a pay cut, and I went from 400 FTEs to 50, roughly 50, if you combine all these departments. So why make this move? We wanted to get back to Utah, sure, but I guess my point that I want to make here is I think we think of leadership growth and progression is very linear, right? You just hit this position, we're marking it. But sometimes it's not linear, and that's okay. I was able to, even though I went down to 50 FTEs, I was able to get experience in clinical departments. And so I think it's important to know what your gaps are as you're trying to develop your skill set. And one of the gaps that I recognized that I was kind of falling in a little bit of a pitfall or maybe getting a little typecasted in my role was, you know, I just kind of do the support services things, right? I don't dabble in clinical. This allowed me to get involved in imaging, which is clinical, laboratory, which is clinical, you know, respiratory, sleep services, some of these clinical areas that I didn't have experience in, and I didn't see myself necessarily getting experience where I was at St. Luke's. So we made this move. It didn't hurt that my wife was actually from Richfield, Utah. So for her, this was going home. And then I also saw leadership opportunities down the road. The CEO, the administrator there, nothing was promised, right? There was no sort of in 5 years you'll get this position, but said he was thinking about probably retiring it within the next few years. And so, you know, it was a little bit of a gamble in the sense that I thought, well, there may be an opportunity to take on that next role, even though this is a little bit of a sidestep way. So became the administrator. I worked in that role for about 5 years, and then about 3 years ago, in 2019, became the administrator CEO of Superior Valley Hospital, located in Richfield, Utah. We're licensed for 29 beds, so we're relatively small when it comes to hospitals, but we're actually pretty large for a rural hospital. We have 2 orthopedic surgeons, 2 general surgeons, a ear, nose, and throat doctor, a visiting urologist, a bunch of primary care docs. And so it's been an incredible experience to kind of lead this rural hospital. Rural hospitals are fairly unique. As I said, you know, I think you wear a lot of hats in the rural hospital. Luckily, Intermountain has incredible resources. If I have a legal question, I can call the legal department. If I have a compliance questions, I got people on speed dial and often use that when I get stuck or have a question, and they're fantastic. It's one of the advantages, in my opinion, of being part of a large integrated health system, is that I've got incredible resources at my fingertips. And so really fortunate to be part of Intermountain and Superior Valley Hospital, and enjoyed my time there so far. I've been in this role, like I said, about 3 years. So just some leadership lessons. I'm reading this book right now. Colin Powell, hopefully you've heard of him, served as Secretary of State, but it's interesting. I'm only in the first part of the book, and actually it talks a lot about a lot of different experiences he had in Vietnam, which I didn't really know about, where he really learned some incredible leadership lessons. So I want to share a few of those. One of the ideas he talks about is when people stop bringing you their problems, you have failed. So when I was at St. Luke's, I mean, it was just, and it's still to some degree, you just get people walking through your office door. You get the email, you get the voicemail, you get the text. There's an issue, there's a challenge. And I kind of used to measure success as, when I stop having that happen, then I've achieved my goal, right? I'm a good leader when I can just have no fires to put out. But what he says here is the day soldiers stop bringing you their problems is the day you have stopped meeting them. They have lost their confidence that you can help them or concluded that you do not care. Either case is a failure of leadership. I really like this, because I think in reality, I had to kind of flip my paradigm and understand, yeah, it'd be nice to not have as many fires to put out. But the fact that people are coming to me, the fact that people are bringing their issues to me means they trust me. And I'm not able to fix it 100% of the time, but at least I can attempt, and that they're willing to speak to me, and I have their trust that way. The other thing is, building a strong leadership team. I was telling Paulo, I'm fortunate. I've got a great leadership team I work with, and that can really mean the difference in any sort of job, but certainly a leadership job. And so he says, pick people with drive and ability to get things done. Powell's rules for picking people: look for intelligence and judgment, and most critically, a capacity to anticipate, to see around corners. Also look for loyalty, integrity, a high energy drive, a balanced ego. I think that one's really important, and the drive to get things done. Interviewing is not a perfect science. I have hired people I thought were going to be fantastic, and in the 30 minutes I thought that, turned out not so great. And I've also hired people where I thought, yeah, they're okay, it's the best option, and they blew me away. I've tried to do some things in interviewing. I try to ask situational behavioral-based questions. Tell me about a time when you dealt with conflict. Tell me about a time you had a goal and achieved it, right? And that's helped me better understand kind of what they've done, how they've done some of these things, and how I can measure it. But it's not a perfect science. It's been challenging, but I'm really fortunate that I work with a great group of people. The other thing he says is simplify. Great leaders are almost always simplifiers who can cut through argument, debate, and doubt to offer a solution everybody can understand. Sometimes people can't follow because of ambiguity. That, in my industry, is huge. Healthcare was already complicated before COVID hit, and it's just exposed all the complications, all the cracks that already existed, and widened the gap. And we've got supply chain issues. We've got challenges with continuing bottom lines dropping as we get reimbursements from different payers, primarily Medicare, which is one of our poorest payers. And how do we solve that, right? How do you create the burning platform of what we have to do? Our CEO, Mark Harrison, who I really respect him, he's going to be leaving in the fall to take another role, but I felt like he was really good at simply explaining the why, right? Why are we doing this? We went through a reorg structure. Why are we reorganizing, right? Why are we doing some of the things we do? And I think the more clearly you can lay that out as a leader, the better buy-off and buy-in you'll have from the people that you lead. So a big one is empowering the people on the front line. He says, in my experience, the people closest to the problem are often in the best position to see the solutions. So in my field of work, this means frequent and consistent rounding with frontline caregivers, our staff, people that are at the bedside every single day. This is critical. It's an expectation that my boss has of me, that I'm out rounding with them. And fortunately, I'm in a smaller hospital. It's one of the things I really like about working in a smaller hospital is I actually can know most people by name. I'm not perfect. There's still a few where I have to glance down at the name badge really quick. But I get to know people, and really that is critical, because when you're going through difficult things, if you're meeting that person for the first time, if you're having that conversation with that person for the first time, it's much more difficult than if you establish a relationship, you understand each other, you know some of the challenges that that person has, and you try to address them. And the other key here is the power of soliciting and implementing employee ideas, what Colin Powell talks about here. This is critical, and Intermountain, I think, has actually done a pretty good job of doing this in a wide scale, right? I mean, Intermountain's, we just merged with SCL Health, which has based hospitals in Colorado, Kansas, so we're now 60,000 employees, big numbers in terms of the organization. So how do you get ideas from your frontline staff that know the problems, and they just need to give you the problem and usually the solution? So if you go to the next slide here. This is something we instituted, Intermountain, I should say, instituted about 5 or 6 years ago. Simple, it's an idea card. They write their name, they write the date, when it was completed by, what's the problem, right? Sidewalk doesn't go the right way, there's a trip right here, I've seen people trip on it several times, we need to fix it. What's their idea, right? Kind of said it right there. How will we measure success? How do we know we're winning? How do we know we've resolved the problem? And then we usually have an approval on there. It's not always required of who it's assigned to. Progress notes, right? So it's just tough to read, but there's check boxes they can do on safety. If it's safety related, sustainability, it has a financial impact, right? To the bottom line is a physician idea. This has been incredibly successful. At first we kind of required people, it was a goal for all employees to have 3 of these a year. And some people would drag their feet and then kind of write things, build us a spa and then just turn it in, right? That didn't really help. But we've really, in the last few years, I think, integrated this into the culture where we don't even have a requirement for our staff. They just know it's part of the process. And managers will actually take this and they'll put it in a box where they'll say it's received, it's in progress, and it's completed. So they'll be able to actually see their idea move along the process. This is our continuous improvement team. It's lean, it's Six Sigma. It's a lot of the things that really high performing organizations, Toyota, all these different organizations have done really well, and healthcare, frankly, is just starting to catch up on in terms of what we need to do. Leadership can be a lonely place to be. It's lonely at the top. Being in charge means operating at a different level than being best buds or being everybody's friend. It's about serving a role for the greater good or the good of the group. This is kind of a hard lesson, one I've had to learn. It's particularly been hard for our frontline managers, who usually were frontline staff and then were promoted to manager. And they're kind of having to navigate that world of, but these are my friends, but now I'm having to have difficult conversations around attendance or performance, right? It can be hard, but it's a really important thing to remember. So the other person, I never met Colin Pass, so that I took from reading him, and I've really appreciated some of his leadership lessons. Joe, I have met. I had the opportunity to hear Joe Horton speak this spring to our leadership team, and I've heard him speak a couple other times. Joe actually was a longtime Intermountain leader, led Primary Children's Hospital for years, ended up being a vice president where he was over all the hospitals within Intermountain. And what I like about Joe is he gets it. He's a very authentic leader. And so he shared with us in the spring, and I'm going to just, frankly, these are stuff I've written down from him, so I want to make sure he gets credit, because I think what he talks about here has been really impactful to me as a leader and something I've really reflected on for the last 6 months as I've heard him talk. He says, in conflict, take on issues, not people. And that can be difficult because there's times you are emotionally involved to it, something you want to do, a project, doing a specific thing. He says, maintain respect and be direct, completely honest and completely respectful. I've seen this go wrong. I've been part of this where I've let my emotions kind of get over, and I've taken on people instead of actually the issue. Keep connections open, avoid emotional reactions, master the art of the crucial conversation. There's a great book called Crucial Conversations. I highly recommend it. It's something that I will try to be working on my entire career. How do you have crucial conversations? How do you do it in a way that's respectful but clear, that you set expectations, that they understand what's expected of them in order to make an improvement. And then make a contest of ideas. Make it a contest of ideas, not egos, right? Let's talk about what we want to do, not necessarily this is my project, it's important to me for my next promotion, and so we need to do it. Promoting a culture of recognition is vital to being a good leader. Recognition is so critical. I think we've all felt it. We've been recognized. Hopefully we've recognized others. But in leadership, you have the unique power of a position to uplift, whether you realize it or not. And you challenge others to build upon their strengths by seeing the good in them. And you move that toward excellence, towards your mission. And then you help others see their contribution. You connect the dots between what they're doing and why they're doing it. And then he talks about a 5-to-1 ratio. So you've got to give 5 pieces of recognition for every 1 point of criticism. Criticism is probably the wrong word, but letting someone know what they can improve on, right? If you balance that ratio out, people are still going to know they need to improve, but they're going to know what they're doing well. And that's critical. So this is something that's been at our hospital for a long time. It's called the WOW card. A lot of different organizations have this. I've seen it. But but it's simple. It's in a bunch of different areas in the hospital. I think this one probably came from the ER. Patient grabbed it, wrote a note. What I love doing is I get these under my door. I take them. In this case, I sent him a picture of it, shot him a text, and just said, "Hey, received this note. Wanted to make sure you saw it. Thanks for all you do for our patients in our community." Helps them understand. There's a lot of the times, especially in healthcare, especially right now, our team's feeling pretty beat up. When it kind of went from heroes during initial COVID to the villains. And so I think it's been critical now more than ever to make sure our team is recognized and understand that they are still appreciated, that what they do matters, and that it makes an impact on our patients' lives. The other one is never assume. There's always two sides to every story. Listen first and ask questions to understand. And it's easy to fall into that rigid black and white thinking. This person's right, this person's wrong, right? I'll have someone come into my office really upset, happened just after a long Labor Day weekend, really mad, right? They're telling me the story and I'm sitting here. My first reaction is going to be, how could they have done this, right? This is terrible. This is not good. Speak with the person, get their perspective. Story's a little different, right? And so I think it's really important to make sure every time before you want to knee-jerk react, make sure you get both sides of the story, to listen, ask questions, ask clarifying questions. Make sure you understand, to try to avoid that thinking where you just fall into that person's good, that person's bad. So focus on things you can control, but don't duck. It's very tempting as a leader to fall into the victim loop. It's very tempting, especially in sort of middle management positions, to say, well, we got to do this because our senior leaders say we have to do it. So sorry, it really sucks. That's not leadership. That is not leadership. Now, and it really, if you have something you're doing that you're wanting your staff or your leaders to do, that's not how you'd want them to present it. How do you explain the why? And make sure that if you don't understand why we're doing something as a leader, then I'm asking questions. So Intermountain made the very difficult decision about a year and a half ago to close all their outpatient pharmacies. We had 2 pharmacies in our area, one in our hospital and one in Salina, which is just north of us in one of the clinics. It was super impactful. It was very impactful in a small community. The reality was Intermountain had been losing money on their community pharmacies for years. It moved to direct mailers. The industry had changed. And so they tried different ways to be able to sell them off so they could still keep that business, but there weren't any takers. And so Intermountain made the, I think, difficult decision to eliminate their outpatient pharmacies. What I had to do as a leader, what I needed to do as a leader to make sure I understood the why and be able to communicate it. Even if people were still frustrated, I couldn't just say, well, yeah, they're doing this and this is terrible and I think it's a bad idea. If I haven't communicated, I went as far as to talk to Rob Allen, who's our chief operating officer of the system, and say, help me understand the why, help me be able to explain this. And he was great. He walked me through the 5-year timeline of what they try to do to keep these going, but had just not been successful and had to make the difficult decision to close those pharmacies. And so I think this is incredibly important. The point Joe makes here is, you have to do your best. When it's time to do goals and do initiatives or make a decision, be vocal, do your best to shape that, to have an input. But when you walk out of the room and the decision is made, as a leader, at the end of the day, you own that. You own that as a leader, and you've got to own that to your team and let them know the why. Otherwise, it's ducking leadership is what he refers to it here. Truth telling is mandatory. Giving and receiving bad news is a must, and you've got to be honest. It kind of comes down to ethics for me within leadership in this realm. Mission directs. What is the mission of your organization? For Intermountain Healthcare, it's helping people live the healthiest lives possible. That's it. And most employees can talk to it. And so what does it mean? What is your North Star as a leader? And then something my boss had me do when I first got in this administrator role was to create a document that defines who I am as a leader. Simple bullet points. I'm still working on it. I add to it. I take some. I modify. But as you get in leadership positions, if you have the opportunity, I'd encourage you to create that. His was 30 years of who he was as a leader, but it was his North Star. It's what defined what he wanted to do. So leadership lessons that I've learned so far. I've said leadership is lonely. This is kind of my take after Joe and Collins, but it's also a team sport. It really requires working together with different entities, with different leaders, whether they're leaders that report to you, whether they're your peers, whether they're those that report to. It really is a team sport and figuring out how you work together. I think it's also really important that you get to know your team on a personal level. The leaders that I've had that have done that with me have been really impactful. Get to know your team. Get to know how they like to be recognized. For some people, public recognition is their worst fear. They hate it. They don't want it. Other people, whether they will admit it or not, kind of like it. And so understand how people like to be recognized and what they're doing and why they do it. Work-life balance is important. This is something I'm trying to improve on. And the reality is you can't tell people have work-life balance if you as a leader are not doing it yourself. You're really not setting the standard there. Understand your personality typology. What I mean by this, anyone heard of Myers-Briggs personalysis? There are these different personality tests that you can take. If you ever get the opportunity to do them, I highly recommend it. I'm in a leadership course right now where I've taken, I don't even know all the names of them, and they all kind of blend together, but they've helped me understand my personality, and not even strengths or weaknesses, because I think it helps understand where you tend to go in your personality as a leader and where others are coming from. That's been really impactful to me as I've gotten to know different personality typologies. Volunteer to take on new challenges. I'm working on a project now to address affordable housing in our community. It's hard. I don't know what I'm doing. No one knows what they're doing is what I'm learning, at least in the healthcare sector, to try to figure this out for our employees and our patients. But it's a good learning opportunity. I've been able to network with a lot of different people within Intermountain and outside Intermountain, and that's been awesome. It's been a really unique experience. And then be human. Let your guard down, have fun. That's been really critical in my leadership. We opened with Napoleon Dynamite, we'll close with Napoleon Dynamite. So when I got to the hospital, I learned that Halloween was a big deal there. Everyone dressed up. I don't even know if it's allowed. If HR finds out at some point, they may shut it down. But every year, departments dress up. People get really excited about it, and it's been really fun. So we went as Napoleon Dynamite. I mastered the mouth breathing there. It comes naturally, but you know, it's been really fun to be able to do some of these unique things. We do a car wash for our caregivers every year. We just did it. Brutal heat. We should have picked another week, but ambulance came through here. But someone said, well, why don't you throw on this costume here? I had to modify the shorts a little bit because they were a little too short. But I think things like that and letting your guard down, letting people see that you're human are really critical for leaders. Otherwise, it's too robotic. It's not personable. It really doesn't connect with the people you're leading, and you lose a little bit of that connection that way. So with that, I think I got close to time, but I'll just pause for questions or any comments. Yeah.
How did COVID affect your leadership style, if at all?
Good question. I feel like it's still impacting my leadership style a little bit. It was weird. I mean, just like a lot of you probably saw in different areas, right? It went very virtual. And so that personal connection that we're having now, right? The face-to-face stuff that you're seeing, you lose something. Even though you can see someone via video, you lose something. So we tried to take time in our meetings that were virtual to have that kind of talk that you have before class starts, before a meeting starts, after a meeting, right? Just the chit chat, catching up, because I think we lost a little of that. So I tried to purposely take some time. The other thing that it's made me brutally aware of is the burnout, particularly in our physicians. We we run with primary care physicians at our hospital. And these guys cover the ER, they cover the hospital. Some cases they deliver babies, and then they're also working in the clinic. And COVID made that burnout significant. ER volumes went from here to here. And so I've really tried to be attentive as a leader to physician burnout, not just physician. I'm not, I think we've had nurses that have felt it as well, all staff, frankly, but understanding what is their source of burnout and how as a leader, can I help, right? And just recommending a breathing exercise probably isn't going to solve it. Maybe for that moment it will, but what do I do? Do I need to change the call schedule for our primary care docs, right? Do I need to look at recognizing in some other way our OR who's just had a 14-hour day working on cases in surgery? So I try to be more attentive to burnout and understand what we can do to address the burnout, because it is something that is really challenging and everywhere right now, but in particular healthcare. So
I think health next to the travel industry and restaurant,
right,
affected by COVID, healthcare was definitely affected a different way because of the nurses having so many COVID patients and the burnout.
Yeah.
My daughter, she graduated from the U, she was the pandemic class, and then her roommate had to finish the last year, and they had the nurse, she had to do an internship, and she got placed with it, and then everybody walked out and up at the University of Utah Hospital, so she had to find another one to do something completely different. That is what she did not want to do for her nursing, because she was getting a bachelor's in nursing. But I go to the doctor, and you still have to wear a mask at the doctors, and so I think that I just totally commend the doctors and the nurses for still still being there and what they've been through physically and emotionally, and having catching the sickness. And remember the nurses that would come home and have to strip down so their family didn't get what they had, and so you guys have been through a lot of change and adjusting to the patient's needs. So I really commend what you've had to manage during that time.
Thank you. No, it's definitely, if you get an opportunity, thank a healthcare hero. It's not, there was that initial really big cheer, right? People banging pots and pans, and then it quickly turned into the villain. When honestly, I think they want to help, and they're trying to help. And so I think it's really been tough. There's a lot of industry change that way, and we're not alone, right? You mentioned several industries that are feeling that, but really important that I think we just take time to be kind to one another.
But exactly. And like I said, you guys still have to wear the masks, and that, the disposable masks hurts the back of my ears.
Mm-hmm.
And so I went to the doctor last month, and the lady was saying, how her thing was breaking. I call it the mask holder. So I started making those during COVID to just help them have a way to get a relief from back there.
Yeah.
And just little things like that they have to go through with how it can hurt their face.
Yeah.
Ongoing to wear. So
we're probably the only place, especially in our little town, that's still asking people to mask up, right? And part of it is actually the CDC that requires it. We're kind of, in order to maintain our standards and our Joint Commission accreditation to be able to serve Medicare patients, we have to meet their standards. And so some people think the hospitals are under this. We're doing it because we're asked to by those that are regulatory bodies around it. So.
Right.
Yeah.
And you talked about working the refugee camp, like in the camp, like with the refugees. What was your biggest challenge working with the refugees?
Well, to me, I learned a lot, frankly. I think for me, we had a couple groups that were at each other, and I didn't fully understand why. There were language barriers, but those weren't insurmountable. I think the diversity actually made us stronger in our department. I really do. So I wouldn't, the challenges were there, but I think the diversity within our department, some of the most incredibly hardworking people I have ever been around, and incredibly giving of their time and different things. And so, there were challenges sometimes with language barriers. We tried to do things because it can be critical sometimes in those instances where we've got a patient in bed that says, something's going on, I have a heart attack or something's going on. How do we make sure that that caregiver understands what they're saying so they can get medical help? So we did some things around, medical terminology in case they encounter that with patients or providers to make sure that they'd be in a position to be able to help those patients so they could understand. So, I think honestly, it was more of a strength, our diversity within that group than we had challenges. There were things we had to work through with language barriers, different modules they had to do for learning and required education, but I think we were able to overcome those and it made us stronger because of it. Yeah.
Just kind of like a two-part question,
Yeah.
but I was just wondering if you could do kind of like an overlay of like the management chain, almost like your boss.
Sure.
Like that. And then also if that's something that you want to move up in, or if you want to change, or if you like where you are.
Yeah.
I'm curious about that.
That's a good question. My wife likes where I'm at. So she likes being in Richfield is what I mean by that. So Intermountain is extremely matrixed. And by matrix, I mean I have dotted lines and straight lines reporting all over the place. They've broken out in different regions just recently. So there's a Nevada region, there's a Utah region, and there's the SCLs from the Colorado, Montana region. So I report to Mike Clark. Mike Clark has responsibility for American Fork down to us. So he's got 4 or 5 hospitals if you count the Intermountain hospitals there. Mike reports to Jim Sheets, you actually saw here. Jim has responsibility for all of acute care. By acute, that means hospital care for the whole region. Jim reports to Sue. Sue's over our Utah region. Sue reports to Rob Allen, who's the COO of the health system. And then Rob reports to Mark Harrison, who's the CEO of the entire health system. That's how we're structured. It's really unique. I actually have my assistant and our EBS manager that directly reports to me. Everyone else is dotted line. So they report to EBS, like a system EBS manager, a regional EBS manager. Same with labs, same with imaging. So that's really interesting to work in that. I'm forgetting the other part of your question.
Just this kind of like if you like where you're at,
Yeah.
you kind of like made the home for yourself, or if you want to go.
Yeah, so the career progression is one that I'm challenged with right now because I love where I'm at, but there's also nowhere where I'm at. There's nowhere else to go, right? I've hit in the CEO role at that hospital, and so I think I would like to grow and probably move into a larger role, whether that's a larger hospital. I love hospitals, so I could go and do like imaging services or lab services, but I love hospitals so much, I don't really want to leave hospitals. So I'd like to maybe move into a larger hospital. That being said, sometimes the grass is greener on the other side. I have such a great leadership team that I'm able to work with every day. The work-life balance I have in a rural situation is totally different than an urban. I can sneak away to my daughter's elementary play recital. I can sneak away and grab lunch with the kids for something. That's just not possible in the urban. Part of that is distance, right? You could be living 40 minutes from the hospital. I live 2.5 minutes. I can walk. I can actually see the helipad from my house, which maybe is a little too close at times. But I think I want to be. My thought process on this is as long as I'm growing, as long as I'm challenged, as long as I'm learning, I'm happy where I'm at. But not that I'll know everything in this role, but if I hit a point where I feel like just feel a little stagnant, I'm not growing, I need more challenges or different challenges, and I think at that point I'm really going to start looking. And for me, that's kind of the 5-year mark in this role. I'm at 3 now. My wife doesn't hear this on the recording because she's anxious about it. She wants to be home. Her parents are there. Her brother is there. So there's that family aspect as well. So I'm trying to balance those 2 things and trying to weigh those options.
You know, I had a similar situation with my last job. It was there wasn't much growth, but the schedule and the convenience was priceless.
Yeah.
Because I was raising my family and my children, and so you know, my boss would let me just kind of come and go as I needed to, and it was, you know, the longest I stayed at any job, it was a decade. And I thought about going somewhere else where I could, you know, make some more money, do something different. But you know, you just look at the things that matter the most, and that's what motivates you to do what you do.
Yeah, it's a balance, and I think you have to weigh, the different costs, and not that I don't have long days. Yesterday was a long day. Till 7 or 8, we were working on some things, but, I think you find what works for you, and then you figure out, what challenges you and what you want to continue to do, or where you're at. If that works, there's nothing wrong with that. Thank you, appreciate it.